my lovelies, welcome to Head Streets. And today you can see we have a visitor on our channel. If you see these, if you see these, if you see this, and if you see this, there are others that we don't have here, like the blood pressure machines. We do not have them here today. But when you see those ones, and just know it's time for vital signs. So today, welcome to Health Streets. Let's talk about vital signs. I'm going to give you an introduction and the basic things you need to know about vital signs, and we can tackle them one by one on another video because you need to understand them in depth. Okay, so what are vital signs? If you hear about vital signs, just know we are talking about somebody's pulse, somebody's temperature, somebody's blood pressure, somebody's respiration, and we also have a fifth one that most books don't talk about, but it's there. So pain is the next vital sign. So I know you're wondering, how do we measure pain? So we assess pain. We cannot measure somebody's pain, but we can assess to know how hurt, how much it is hurting, or how the extent of the ache. Okay? So when it comes to vital signs, why am I showing you these things? Why am I having a stethoscope? What is this for? Actually, let me give you a small tour of the stethoscope. So these ones, these are the earpieces, these two, and this is the tubing, and this is the diaphragm. Both sides can be used the same way. So that is the stethoscope, tubing, diaphragm, earpieces, those gray little things there. You put them in your ears and you listen to somebody's whatever you're taking. Okay? Pulse, heartbeat. That's what we use stethoscope for. So we also have this one. This is a digital thermometer. It is the most commonly used for taking temperature nowadays. You can use it for oral temperature, sublingual, under your tongue. We can use it for axillary temperature, under your armpit. We can use it to just take temperature in several sites. We have different types of thermometers. For instance, we have this one here. This one is a glass mercury thermometer. It is I think it's the oldest thermometer we have. Nowadays, people avoid to use it because it's they say it's slow and it can break. You know, this is glass. This is glass. You can feel. You can hear that. It's glass. It can break and expose. This is mercury. You see that silver. That silver there. That is mercury. It can break and expose you to mercury. So that's why people are avoiding it. But it is the oldest form of thermometer that we've ever had. It was used before all these others were discovered. We have tympanic thermometers we use in your ears. We have temporal ones. We use them here. They sense. You remember the COVID time, the temperatures used to be taken on your from your forehead, and those thermometers would sense your temperature. So those kinds of thermometers, all those. We have rectal thermometers, but the most commonly used site for temperature taking is axillary, under your arm. What else? Okay, I didn't tell you what the stethoscope is used for. So the stethoscope is used to take your blood pressure. It's one of the items you use in blood pressure taking. And pulse. Pulse is the heartbeat felt in your arteries. Whenever your heart beats, you can listen to your pulse. So, but now when you're taking an apical pulse, there's a pulse that is called apical pulse that is taken directly from your heart. I will show you how we do that later on. So as we tackle vital signs one by one. So if somebody has got, especially if somebody has got a heart disease or is likely to have an irregular pulse, that's when we use the stethoscope. And when it comes to blood pressure, I know you're wondering, we have blood pressure machines, the digital ones. Why are we having a stethoscope to do blood pressure? Yes, we use the stethoscope when we are doing the original blood pressure taking method. Okay, some medics prefer using they think it's more accurate, but I know people just want to do, to get results as quickly as they can, and that's why digital blood pressures are there. But the original way of taking blood pressure was using the stethoscope and a cuff. A cuff is usually placed on the brachio site here, and then you listen with your stethoscope to feel the systole, the diastole. There's just a method of taking blood pressure where we will use the stethoscope and the cuff. Okay, so now that one, that is one of the methods for taking blood pressure. And then what else have I not mentioned? Yeah, I've told you the vital signs. We have 4, and a 5th one, that is pain. Something else to note is that whenever you walk into a doctor's room or into a hospital, the first thing that is taken is the vital signs. And somebody might be asking, what about height and weight? Because they are taking, okay, they are not vital signs, but they are essential. They are important measurements to assess how your body is functioning. So you'll see them taking your height and your weight alongside vital signs. So I hope we are clear with that. So the next thing I'm going to tell you is about, in this vital sign, let's talk about the ranges. So what are the ranges of these vital signs? So I think I have to write them down so that I cannot forget the one I've tackled. So the first one is, let's talk about temperature. So we can start with temperature. So your normal temperature should be between 36 degrees Celsius to 37.5 degrees Celsius. And for those who are using Fahrenheit, it should be 97.5 degrees Fahrenheit to 99.5 degrees Fahrenheit. That is the normal temperature range. And then the next one, let's go to, which one will we tackle next? Let's talk about pulse. Pulse, as I've told you, is the heartbeat that you feel. There are several sites for taking your pulse. We have apical pulse, we have brachio. Brachio is here. We have radio pulse. We have temporal pulse. You can feel your pulse here. We have carotid pulse here, under your jaw there. We have the apical pulse there. You can feel it. So we have several sites for taking a pulse, and your pulse should be between 60 beats per minute to 100 beats per minute. That is what we call a normal pulse. But actually all those vital signs differ depending on, there are factors that can affect your vital signs. Could be environmental factors. How is the temperature? It could be your body, emotional, your health status. They can affect your apical pulse, your pulse. And that's why we are taking vital signs as the first thing when you get to the hospital. They are going to give us an idea of what is going on in your body. Okay, so where were we? We were in the pulse, and I've told you the correct, the normal range for pulse is 60 beats per minute to 100 beats per minute. So we are done with pulse. Let's go to the next one. Let's talk about blood pressure. So what is blood pressure? So blood pressure is that force that is exerted in your artery, your arterial walls, your arteries, the walls of your arteries. When the heart muscles contract, how much force is exerted to the walls of your arteries? So that is what we call blood pressure. And when you're using the that's why you feel tightened by that machine, because it's trying to see how much force is there actually. You see, so that is the blood pressure. And what is the normal blood pressure? So the normal range for blood pressure, we measure it in systolic over diastolic. So the normal systolic is usually between 100 to 140, and diastolic is usually between 60 to 90. For instance, if somebody comes with a blood pressure of 120 over 60, that is okay, because, or 120 over 80. So that means the systolic is 120 and the diastolic is 80, which is okay. It is in the normal ranges. So if they go above there, if somebody comes with 146 over 100, that is hypertension, that is high blood pressure. So if they come with lower than that, so they can, let's say they come with 60 over 40, that is hypertension, that is low blood pressure. So you understand? So blood pressure, systolic over diastolic, and that is 100 to 140, that is systolic, the normal range of systolic, and the normal range for diastolic is 60 to 90. So your blood pressure should range be between there. And if you use the digital BP machine, it's just going to give you 120 over 80, no hassle. But if you're using the other way I was telling you, this one and the cuff, you have to listen to the diastolic, and then you have to listen to the systolic, and that is what that's how you're going to know the blood pressure of your patient. But with the digital, as I told you, it's automatic. You just see it on the screen. Okay, so let's go to the next one. The next one is, so we have covered temperature, pulse, BP, and respiration. So what is the respiration? Respiration is breathing in and out, basically. So how many respirations are you supposed to take? What is the average respirations for that we call normal? So for respirations, you just look at falling and the rising of the chest of your patient. You don't have to tell them you're taking their respiration, because they might panic and start breathing abnormally. So you just watch. It's how many breaths are they taking per minute. Usually it's supposed to be between 12 and 20. Those are the normal respiration rates. If it's above that, then it's high. If it's below that, it's low. Okay, so that is the basic things to know about the vital signs. I'm hoping that we are going to cover one by one in-depth vital signs. For example, we talk about temperature, we talk about blood pressure, how we take it, how step by step, and that one requires a different videos. I do not like having long videos because they can be boring, and I also don't like listening to long videos. Okay, so I hope you've understood vital signs. Don't forget temperature, blood pressure, pulse, respiration, and pain. And when it comes to pain, we have a way of assessing pain. So don't ask me also, if a patient comes in, how do I know about their pain? We have something called OLDCAT. OLDCAT is an acronym that is used to assess pain. We have the onset of pain, the location of pain, the duration of pain, characteristics of pain, what makes the pain worse, what makes the pain go, that is the relieving factor. Then we have treatment. How can we treat this pain? I hope we've done something on vital signs pretty much. And just a recap, the vital signs: we have temperature, we have pulse, we have blood pressure, we have respirations, and then we have pain. Okay, so you've seen the ranges. You can go back to the video and see the ranges of all that. And I think we should cover I'm going to give you some terms that are used in vital signs. I hope that is all right. Let me see how many minutes our video is. It's all right, guys, we can continue. We still have a little bit of time. So yeah, we were talking about some terms used in vital signs, and it's wise to tackle them one by one. And let's talk about temperature. In temperature, you'll come across terms like pyrexia. So pyrexia is an increase in body temperature above the normal, that is above 37.5 degrees Celsius and above 99.5 degrees Fahrenheit, for those who use Fahrenheit. I've seen the American system likes to use Fahrenheit, and the Kenyan and some other countries, they like to use degrees Celsius. Okay, and then you'll come across if somebody has got fever, we say that person is febrile. Okay. We also have hypothermia. Hypothermia is a low body temperature. All right. Then we go to pulse. So important things to note about pulse is that there are several things you need to know. First of all, the pulse, we take it for, let's say you're taking the radio pulse or the temporal one. Usually we do the radio one. That's radio pulse. Radio pulse is the most commonly one. So you have to place your finger there and feel it. You feel the pulse for 30 seconds and then you multiply by 1. And remember, when you're feeling the pulse, you have to consider aspects like the rhythm, the strength of the pulse. Don't just listen to the pulse. Don't just feel the pulse without considering those other factors like the rhythm of the heartbeat, the strength. Is it a bonding pulse? Is it a strong? Is it a weak pulse? You can have a weak pulse where you're feeling it from very far. So something else to consider about pulse is that it differs with age as well. There are so many factors, just like any other vital sign, that affect the pulse of a person. For instance, if you see a baby who is between birth to 4 weeks having a pulse as high as 180, the normal pulse is between 60 to 100. So if it goes as high as 180 in a child, he's okay. He might be okay because children's pulse can go as high as that. I mean, that age. We have age brackets where the pulse differs according to age brackets. From 12 years to adult is the one that is 60 to 100, but these other infants and toddlers that follow, they have a higher rate of pulse, and the highest being between birth to 1 month. Okay. Something else to consider in pulse is about if somebody has got an irregular pulse. Usually we take it directly from the heart, where we call apical pulse, and that one we take for a whole minute. We don't take it for 30 seconds. Okay, remember that, not 30 seconds, but a whole second. Another thing, before you take somebody's pulse, remember to warm your diaphragm with your palm, because imagine this is metal, it's very cold. Okay, you don't want to scare your patient. And then another thing to note about pulse, is that everything about pulse? Oh, and before you use your stethoscope, always remember to, okay, this is a general hack, always remember to disinfect your earpieces. Even if you're the only one who uses them, disinfect them with a cotton wool and a disinfectant. Okay. And with this one, if these earpieces are in your ears, make sure this one is not touching somewhere else, because unless you want to burst your ears, you're going to feel a very, very loud voice from this diaphragm. It picks the slightest. If it's able to feel your pulse from your arteries, what about if you hit it? Imagine if these ones are in your ears and somebody hits these on the table, ears gone, your tympanic membrane gone. Okay, that's a lighter note. So let's look at the next vital sign, the hacks we need to, the terms and what we need to know about it. Okay. So the next one, you're going to look at respiration, guys. So the things to consider to pay attention to in respiration. So when you're taking respiration, you look at one respiration involves falling, or rather rising and falling of a chest. That is one respiration. So that is one respiration, one breath. So you count 3, 4, like that. And don't tell your patients that you're taking it, because they're going to be, they're going to just make it normal. You could be taking a temperature and then you take that opportunity to take your patient's respiration. So what was I saying? So one rise and fall of a chest is one respiration. So you count those for 30 seconds. You count how many rising and falling of a chest. I mean, how many cycles are there in 30 seconds? Then you multiply by 2. Let us say your patient has taken 7 breaths in 30 seconds. So you multiply by 2. That means your patient's breathing rate is, or rather respirations is 14 per minute. Okay. So that is one thing to consider. And then you'll also come across some terms like tachypnea. You'll come across things like, okay, tachypnea is a higher than normal respirations, higher than 20. Okay, you'll come across bradypnea. Bradypnea is lower than the normal respiration rates. That is lower than 12 respiration rates per minute. You'll come across things like apnea. Apnea means there's no breathing. You'll come across things like dyspnea. Dyspnea means shortness of breath. All right, you'll come across something like hyperventilation. Hyperventilation means fast and deep breaths. You also come across a term like hypoventilations. Hypoventilations means slow and shallow respirations. All right, I think that's all about respiration. The next thing for us to consider is the blood pressure. What do we need to do about blood pressure? I told you the normal blood pressure ranges between millimeters of mercury, that is Hg, and there's some factors that can affect your blood pressure, and those factors are things like factors like age. Your blood pressure is likely to rise with age. So as you grow older, your blood pressure is likely to rise. And then we have factors like gender. Generally, in general, women have got a lower blood pressure compared to men. You know that, right? And then we have things like diet. So somebody who takes a high sodium diet is likely to have a high blood pressure. So avoid so much salt in your food, you guys. Salt has got sodium, right? And then we have things like exercise. If you're from exercise, your blood pressure is going to be high. And then we have something like which other factors affect your blood pressure? The medications you're taking. We have some medications that can increase your blood pressure. We also have weight of a person. Generally, overweight people have got high blood pressure, and that's why you're told to maintain your weight. Like, just work on your weight, please. Try to, yeah. Another factor is race. It is said, according to research, that people of color or black people usually have a higher blood pressure rate than our counterparts, the white people. You can do that research and see. Another thing is position. So position, if you're lying down, your blood pressure is going to be lower than when you are walking or seated or in any other position. So yeah, some positions can lower your blood pressure or raise it. Okay. Another thing to consider is pain. When you're in pain, your blood pressure is going to be high. Okay, your blood pressure is going to be high when you are in pain. Stress. When you're stressed, your blood pressure goes high. We all know the blood pressure and stress, how they are associated. Okay. Another thing you're going to consider is the blood volume. If somebody has had severe bleeding, that is going to lower your blood pressure. Okay, so that is actually one of the factors that can let you know that somebody is having hypovolemia, is having low volume of blood when the pressure is low. Right, I think that's all about blood pressure. Let's check on our next thing on vital signs. I hope you guys are getting it. And so this last one, this vital sign is going to be our last one, and that is pain, guys. And as I told you earlier on, pain means to ache, to hurt, to be sore. That is pain. And when it comes to pain, it is subjective. Some people can describe a certain pain to be more hurting than the other person. So it is entirely subjective. Okay. And we have types of pain, you guys. We have chronic pain, we have acute pain, we have phantom pain. And then we have radiating pain, all those types of pain. And what is acute pain? So this is just a pain that is not too much. It results from disease. It is short term, resulting from a surgery, a disease, a trauma, an injury. So that is acute pain. And then we have chronic pain. Chronic pain is a pain that lasts for more than 6 months, and this pain can be consistent or it can be on and off pain, but it has been there for 6 months. Then we have radiating pain. Radiating pain is a pain that comes from a site of injury. That site, let's say this is the injured part, so that part and the surrounding areas, so that is radiating pain. And then we have phantom pain. It's a bit tricky, but this is a pain that you feel from an organ that is not there. So let's say a patient lost their limb or their lower leg. They have lost a part of their body, but they are talking of pain from that particular part of their body. And you're going to understand what that means as we progress and talk about the nervous system. There is something we call law of projection, where certain nerve endings, detect a pain from a certain place. Okay, law of projection. So that is phantom pain, a pain from an organ that does not exist, but they are feeling the pain from there. All right. We talked about assessment of pain or somewhere along this video as we were starting, and I gave you an acronym, OLDCAT. OLDCAT is old cat, OLDCART, OLDCAT. So let's talk about this acronym. We have O, that is the onset of pain. When did the pain start? L, the location of the pain. Where is the pain? D, that is the duration of pain. How long have you had this pain? C, that is the characteristics of pain. And the characteristics of pain, they can be somatic, they can be visceral, and they can be neuropathic. So let's look at them one by one. So somatic can be sharp, dull, or aching, right? And then we have visceral. Visceral can be cramping or squeezing. It can be electrical, tingling, shooting, numbness, all that. That is what we call neuropathic. That is the characteristics of neuropathic pain. All right. So we're in characteristic cut. So we are in A. Aggravating factors. What worsens your pain? What worsens the patient's pain? All right. These factors that worsen the pain. And then we have the relieving factors. What makes the pain go away or make it less? What makes the pain less? That is the relieving factors. And T, that is where now the physician decides on the methods of treating the patient, of relieving the patients of pain. It could be a psychological pain. It could be a pain that needs medication. That's where we decide and come up with treatment. All right. So guys, I think we have come to an end of vital signs. There is so much to cover about it, but the moment you learn these basic things that we have talked about, I think you're good to go and you can empower yourself on more knowledge as time goes by. All right. So until the next video, peace guys. Bye and have a lovely, amazing time.